So I did my presentation on art therapy as a mode of treatment for attention deficit hyperactivity disorder. So what is attention deficit hyperactivity disorder? ADHD is defined as a neurodevelopmental disorder marked by an ongoing pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. There are 3 different types of ADHD. The inattentive type, which is also known as attention deficit disorder or ADD, hyperactive impulsive type, and then a combination of the two. So as far as their symptoms go, for ADD, the symptoms would be trouble organizing or finishing a task, paying attention to detail, maintaining interest in conversation, and following instructions. For the hyperactive impulsive type, the symptoms would be persistent fidgeting, trouble sitting still for a long period of time, feelings of restlessness, impulsive decision, and being unable to work quietly. And then people with the combination type experience both inattentive and hyperactive impulsive symptoms. So, as far as art therapy goes, the American Art Therapy Association defines art therapy as an integrative mental health practice that combines theories of human development and psychology with visual arts to help clients improve psychological health, cognitive abilities, and sensory motor functions. Basically, what it does is it combines talk therapy with the creative process, thus pairing verbal and nonverbal expression for better overall results. So, the benefits of treating ADHD art therapy are vast. One of the biggest ones would be that art therapy allows the patient to capture intense experiences and constant fluctuation of thoughts and feelings that often come with ADD and provides the child with a form of release. The art activity used in art therapy usually involve ordered steps that provide structure to the session. And so following sequential sets of steps within each activity can help build controlled attention and attention sequencing skills for those affected by ADHD. And a third benefit of treating ADHD with art therapy would be that the product of art therapy, which is the art itself, allows the patient to keep a visual record of their feelings and progress throughout their art therapy progress. This is beneficial because patients with ADHD often have difficulty applying what they learn because of how fast their mind moves between thoughts. Another way to treat ADHD with art therapy would be through group therapy sessions. Not only does group therapy allow the therapist to have another setting to observe their patients, it also provides the children with an opportunity to practice group skills and manage their ADHD in a safe place. Art therapy group sessions also provide the children with a newer understanding of their strengths and weaknesses by providing an arena in which those strengths and weaknesses can be played out. In addition, group sessions offer the patient an opportunity to be exposed to other methods to help them improve their ADHD symptoms and their social skills as they learn how to plan, organize, share ideas, feelings, space, and materials. This overall may allow the patient to be more comfortable interacting with other children both at school and at the playground. So, I also included a little bit of research on a couple case studies that help prove that art therapy works in treating ADHD in children. So there was a case study conducted by Hina Ayes titled Using Art as Therapy with a Child with Attention Deficit Hyperactivity Disorder. The study was based on a 6-year-old girl from Pakistan who suffered from the hyperactive impulsive type of ADHD. This girl had problems remaining seated in class, waiting for her turn when playing in groups, and demanding immediate attention, and also she struggled with just cleaning up after herself. So this patient took part in 25 art therapy sessions guided by a qualified therapist over a course of about 14 to 15 weeks. Both before and after her intervention with the art therapist, the patient was subjected to an attention deficit hyperactivity disorder test that was based on the DSM-4 criteria for ADHD. The test consisted of 3 subtests in both hyperactivity, impulsivity, and inattention. And then after that, the scores were computed for each subtest, and raw scores were converted to standard scores and percentile ranks. After the post-intervention testing, the researcher actually found that her scores on the ADHD test actually decreased, which signifies that it helped treat her symptoms and make her more manageable to be at school. There was another study that was conducted by Y. Benita Little Jessie, and her study aimed to determine whether there would be a significant difference in behavioral problems of children with ADHD after drawing and painting. So this study used a group of 30 school-age children who each had an ADHD diagnosis. So the researchers completed a pre-intervention assessment in which they rated the patient's inattention, hyperactivity, and impulsivity symptoms on a 4-point scale. During this assessment, they eventually found out that 6 out of the 30 children with ADHD had moderate behavioral problems, while 24 of the 30 children had severe behavioral problems stemming from their ADHD. So the intervention used for the study consisted of having the patients draw and finger paint every day for 6 weeks while being observed by an art therapist. After the 6 weeks of the intervention, the researchers then used the same assessment utilized in the pre-intervention assessment to rate the children's symptoms on a 4-point scale. And basically, the researchers found that after only 6 weeks of intervention, 10 out of 30 children now had only moderate behavioral problems stemming from ADHD, while 20 had severe problems. This basically means that there was a statistically significant reduction in behavioral problems caused by ADHD, and thus proving the benefits of using art therapy to treat this disorder. So, something specific I learned about this population related to art therapy that I didn't already know was that the artwork that the patients are able to create in their art therapy sessions may serve as a reminder to them about what they learned and how they can apply what they learned to what's going on inside their head. As someone who has ADHD, I understand that a patient may completely forget what they learned in therapy without a visual or physical reminder afterwards. Something that I didn't find out that I'd be interested in learning more would be if the same activities used in art therapy for children to treat ADHD would also benefit adults with ADHD in the same way, and vice versa. And finally, some challenges or opportunities I could see with working with the population. The biggest one that I could see when working with people with ADHD would be having a patient lose interest in the art activity before it's even over. I understand that people with ADHD tend to start things and then never actually finish them because either they lost interest or they just completely forgot. So I could see that as being a problem, and I could also see them forgetting to apply what they learned outside of therapy in the real world, just because they completely forgot. They're not talking about it, so they're not sure.